Today's healthcare organizations generate and manage massive amounts of data, including patient information, clinical data, operational data, financial data, and more. This data is dispersed across several systems and applications, making it difficult to access, examine, and exploit for decision-making. This lack of access into crucial data points leads to inefficiencies, missed opportunities, and eventually affects the quality of care offered to patients. Problem statement: lack of patient engagement. Patients today want more personalized and cost-effective experiences in healthcare. Increasing healthcare cost. Expense of pharmaceuticals, medical equipment, and hospital stays. Healthcare regulatory changes. Regulatory problems influence healthcare organizations by raising the cost of healthcare services. Insurance and payment systems. Patients get baffled by both the insurance explanation of benefits and their part of the expenses. Health information overload. Overflow of health information are challenging to manage and comprehend. Healthcare workforce shortages. Lack of educated and certified healthcare workers, including physicians, nurses, and other healthcare personnel. Chronic disease management. Chronic disorders need continuing care and treatment, leading to cost and time for both patients and healthcare professionals. Information and integrated health services. Lack of modern architecture and data management systems for managing data from many sources. Healthcare organizations require a mechanism to integrate and visualize their data in real time to make educated choices, enhance care delivery, and optimize operations alongside following the FHIR standards. The EHR dashboard with FHIR data model is a powerful tool that gives healthcare practitioners a full picture of a patient's medical history, present problems, and continuing care plan. It enables providers to access and assess a multitude of patient data, including test results, vital signs, prescriptions, allergies, and more. FHIR and Electronic Health Record (EHR) solutions can work together to enhance medical service delivery and patient satisfaction by enhancing interoperability, boosting patient involvement, enabling more informed choices, and increasing efficiency. Using Bizdata 360, an EHR dashboard is designed with data coming in from several sources in various data formats and FHIR data models. Bizdata 360 can combine data from numerous sources and in any format. Using HL7 and FHIR API, an interactive dashboard is set up, which is separated into multiple tabs reflecting different information about patients, care plans, medication, hospital, and laboratory. Patients today want more personalized and cost-effective healthcare services, just as they do in other businesses. They desire to have everything at the tip of their fingers. The first tab offers extensive patient data to promote patient participation while also assisting healthcare providers in making educated decisions about their patients. From basic information about patients to a description of their medical condition, including their city of residence, gender ratio, and interactions, as well as a geographical map. The Patient tab gives users a comprehensive access to the patient's information. The Care Plan page follows, with information on insurance providers, the proportion of patients who have gotten insurance policies, and a complete table of insurance by patient. Over 70% of patients are perplexed by the insurance company's description of benefits as well as their portion of the expenditures. As a result, this tab assists users in learning about the many insurance providers accessible in the market, as well as the plans and insurance coverage they give to their consumers. At the same time, healthcare providers may obtain the percentage of their patients who have obtained insurance plans, as well as other information such as the type of plan they have, the provider, and the length of their insurance plan. One of the most serious issues plaguing the healthcare sector is the rising expense of medical treatment. This includes the cost of medications, medical equipment, and hospital stays. The Medication tab presents the medical history of many patients in the form of a comparison table, allowing the user to compare the patient's care in various facilities, as well as prescription data. It also focuses on medicine costs, assisting both physicians and patients in understanding the costs and places where cost-cutting may be done, as rising healthcare costs are a key worry for both doctors and patients. To fully realize the promise of healthcare technology to revolutionize health systems and create a connected healthcare environment, healthcare executives and physicians must collaborate more closely with medical manufacturers and software application development organizations. However, with the need to integrate modern health technologies, the healthcare industry is also suffering a shortage of trained and qualified healthcare employees, including physicians, nurses, and other healthcare personnel. The Hospital tab, which displays information of numerous hospital data such as the personnel, funds collected, and gadget inventories, follows to offer insight into this dilemma. This tab will assist the organization in understanding the departments where new hires are necessary, as well as the aging infrastructure and gadgets, as well as the regulatory regulations that various organizations follow. Diabetes, heart disease, and cancer are all becoming more widespread throughout the world. These illnesses need ongoing care and therapy, which may be expensive and time-consuming for both patients and healthcare providers. The Laboratory tab focuses on various people, diagnosis findings, and the percentage of patients suffering from chronic diseases, which aids in chronic disease management. The dashboard is intended to be extremely configurable, with various modules and widgets that may be added or discarded based on the needs of the provider. It is also meant to be very intuitive and user-friendly, with easy-to-read charts, graphs, and tables that allow healthcare professionals to immediately detect trends and patterns in a patient's data. Providers can also dig down into individual data points to acquire more granular information, such as the exact day and time of a prescription being given or the specific results of a laboratory test. Overall, the EHR dashboard is a powerful tool that helps healthcare providers deliver high-quality, patient-centered care. By providing easy access to comprehensive patient data, providers can make informed decisions about a patient's care plan, track progress over time, and identify potential areas for improvement. Benefits: healthcare data management, complete accessibility to patient information from any location, increased patient engagement, increased coordinated care and better diagnosis, data privacy and security, meeting regulatory obligations, cost-cutting measures and increased efficiency. Who need EHR? Doctors, pharmaceutical companies, patients, regulatory agencies, laboratory, insurance companies.